Welcome back, students. We'll continue with the antitubercular drugs, the remaining part of this topic. After having seen about tuberculous infections and the classification of drugs as primary line drugs and secondary line drugs in the treatment of tuberculosis, let us move further into the chemotherapeutic regimens used in the treatment of tuberculosis. So, the learning objectives for this session will include first, to know the chemotherapeutic regimens in the treatment of tuberculosis. Second, to understand the study National Tuberculosis Control Program guidelines. And third, to know the prophylactic therapy in tuberculosis. Well, in our earlier class, we have seen about the tuberculous infection, the causative agent, and the two category of drugs as primary drugs and secondary drugs used in the treatment of tuberculous infection. The primary drugs, namely isoniazid, rifampicin, ethambutol, pyrazinamide, and streptomycin. Whereas in the secondary line of drugs, which includes paraminosalicylic acid like drugs or aminoglycosides, cycloserine, vancomycin, amikacin, corticosteroids, ofloxacin, and ciprofloxacin type of drugs. The first category of drugs being less potent and more efficacious, and second drugs being less efficacious and more potent. This is what we have seen in the last class. Now, we are aware about this infection that it is being there for the past 7 decades. So, although tuberculosis treatment is carried out for past 7 decades, an optimal regimen and duration of the treatment of tuberculosis needs to be followed. For complete effective treatment, we need to strictly follow the regimen which is prescribed for tuberculosis. Now, the best chance of bringing about a rapid and complete recovery is in the early stages when the organisms are multiplying rapidly with multiple drugs. So, only when the bacteria is multiplying rapidly, we can get these organisms exposed to multiple drugs in order to curb the tuberculous infection. So, the best chance is during the early stage, how to curb it. And the importance of chemotherapy here is basically to prevent subsequent pulmonary lesions and should be treated with standard triple drug therapy. So, the treatment of tuberculosis is divided into two phases. One is the initial phase, which employs three drugs to be used to reduce a viable bacteria. And these three drugs, they all belong to the primary classification. And treatment is with INH, rifampicin with ethambutol or streptomycin for 8 weeks, and preferably until the drug sensitivity testing is known. See, normally we do that sensitivity, testing for tuberculosis. So we get sputum positive patients as well. So when the patient is detected sputum positive, these patients are normally hospitalized for for the initial phase of the treatment, and they are exposed to these three drugs. So in initial phase, we have to use three drugs, and it is a daily treatment with INH, rifampicin, with ethambutol, or with streptomycin for a period of 2 months, that is 8 weeks. In the continuation phase, the treatment can be provided at home, provided there is good patient compliance. And this is continued with only two drugs. INH, which is the most preferred drug. INH is a classical drug used in the treatment of tuberculosis. And ethambutol. INH with ethambutol or INH with rifampicin for a period of 9 months, 12 months, or with 18 months at home. So look at this. 2 months for initial phase and maximum up to 18 months. From 9 months to 18 months, it varies in continuation phase. So look at the period of treatment. It is very vast because as we discussed last time, that this tubercle bacilli, they grow very slowly, and therefore the problems associated with drug resistance, patient compliance, they multiply as the treatment progresses. So we have to strictly follow the regimen which has been initiated by the World Health Organization, which we are going to see in the next slide. And this strictly has to be followed for better treatment. Well, as we have seen in the earlier slide, that the tuberculosis infection needs to be followed with two phase of treatment, the initial phase and the continuation phase. But however, if patients, if they are not relied upon to take the drugs regularly, now there are cases where there is poor patient compliance because of the medicine related issues or with patient related issues. So they have to be treated in such cases, they have to be treated in the hospital or as outpatients. But if there is a relapse, that means the patient has taken the drug treatment, completed the course, completed the treatment regimen, but in spite of that, they have turned out to be sputum positive, that is, the tubercle bacilli is still dwelling in their body. If there is a relapse and the symptoms are seen after the previous treatment, previous drugs are not at all used. In such a case, the alternate second line drugs are used, which are potent drugs. Okay. Now, so what are the possible reasons for failure of chemotherapy in tuberculosis? This could be due to irregular or inadequate therapy due to poor patient compliance. Second, uh, there's a possibility of using a single drug because of interruption of the therapy, maybe due to some hypersensitivity or toxic reactions shown by the drug, because of which they are going only for single therapy, the patients. Or third, it could be due to inadequate initial triple drug therapy and the resistance, microbial resistance, which develops to the drugs in use. So, there are several other problems also in the management of tuberculous meningitis. Problems in the management include, it may arise due to, like, for example, in case of meningitis, a case, tuberculous meningitis, it could be due to poor penetration of the drugs into the cerebrospinal fluid. Now, although INH is the most useful, the most preferred drug, most ideal drug, what we say, isoniazid, used in the treatment of tuberculosis, streptomycin also penetrates optimally when the meninges are inflamed. Rifampicin penetrates very poorly of the first line drugs, whereas pyrazinamide, it penetrates fairly well. So these are some drug characteristics also we should know when we are treating the type of tuberculous infection, whether it is meningitis or pericarditis or peritonitis or osteomyelitis related to bone or due to pulmonary type. Look at the other example. Now for genitourinary tuberculosis, now another drug is preferred in this case. Why? Cycloserine is usually considered as a primary drug in this case. Why? Because it selectively gets concentrated in the urine and gets incorporated automatically in the triple drug regimen. So these are some features which we need to remember why the failure for chemotherapy is the possibilities of failure of chemotherapy is prevalent, and what are the possible problems in the management of tuberculous meningitis because of drug related parameters. In this slide, we are going to talk about the certain guidelines brought about by the National Tuberculosis Control Program. Now, for effective treatment in tuberculosis, the National Tuberculosis Control Program guidelines talks about certain categories of patients and how the treatment modality or schedule has to be adopted. So, in this case, patients of tuberculosis here are categorized depending upon the site of the disease. There are basically, we know that there are two main sites of the disease, the pulmonary tuberculosis and the extrapulmonary tuberculosis and its severity. And second, the sputum smear positivity or negativity. So after the sputum test, microbial test, whether it is positive or negative, depending upon that also categorization has been done. And the third mode of categorization is history of the previous treatment. What previous treatment during, after relapse and all, what previous treatment was being taken by the patient. So depending upon that also the future course of treatment will be carried out. So here you have got patients categorizing, being categorized on the basis of site of disease, on the basis of sputum smear positivity or negativity, and on history of previous treatment. Now, all treatment regimens which falling under this program uh, will definitely consist of the initial phase of 2 to 3 months, wherein the tubercle bacilli is rapidly killed, and this gives a symptomatic relief to the patient, and which turns the patient sputum to convert to a negative report. That is the sputum conversion to negativity. Now, this is followed by a continuation phase of 4 to 6 months of treatment, which eliminates the remaining bacilli so that relapse does not occur. So, we'll go to each category, and we'll also see that which drugs are being used, and what is the treatment schedule. In category 1, the category 1 is classified as those patients which are new, who are new, that is, they are untreated, smear positive pulmonary tuberculosis patients, or it could be new smear negative pulmonary TB with extensive parenchymal damage, or new severe forms of extrapulmonary TB like meningitis, pericarditis, peritonitis, and all, or intestinal TB or genitourinary TB cases. So you've got three categories. One is new smear positive cases. Second is new smear negative pulmonary TB with some extensive damage. And the third, new severe forms of extrapulmonary TB. So in this case, category 1, you've got an initial phase wherein there is a daily treatment of isoniazid, rifampicin, pyrazinamide, and ethambutol. Now look at the table. I put as 2HRZES. That means for a period of 2 months, these drugs, H for isoniazid, R for rifampicin, Z for pyrazinamide, E for ethambutol, or S for streptomycin, is being daily given. So daily dose of these drugs for a period of 2 months. 2 is the number which is appearing before the letters is the number of months, and the number which is appearing in the suffix, that is small 3 or small 2, you get to see those are a number of times the drug has to be given per week. That you get to see in the continuation phase. So after the initial phase of 2 months treatment with these drugs, the primary line of drugs, next comes the continuation phase wherein the patient is treated in case of category 1 for a period of either 4 months with isoniazid, rifampicin, or 4 months of isoniazid treatments thrice in a week, or rifampicin treatment thrice in a week, or for a period of 6 months with isoniazid and ethambutol treatment. So you get to see that the total duration in case of category 1 treatment can vary from a period of either 6 months, that is 2 plus 4 is equal to 6, or a period of 2 plus 6 is equal to 8 months duration. So here you have an initial phase where the patient is treated for a period of 2 months, and if it is not satisfactory, it can be extended for another 1 month in initial phase itself, and then which is followed by a continuous phase for either 4 months or 6 months treatment, and the total duration ranges from 6 months to 8 or 9 months. In case of category 2, now which are the patients coming under category 2? Category 2 will comprise of those patients which are smear positive treatment failures. That is, cases who remain or again become smear positive months or later after starting the treatment, or were smear negative to start with but have become positive after 2 months. So here you have a different case wherein in category 2 you have got patients who are positive treatment failures, and who must have been smear negative, but over the period of course of times, because of not taking the medicines properly, they have turned out to be smear positive. Or the second case is relapse cases, wherein the cases have been declared cured or one full chemotherapy course is over, but they turn out to be smear positive. Or the third condition is interrupted cases. Interrupted cases means cases who interrupt treatment for a period of 2 months. They are not able to continue the treatment for a period of 8 months. In between, they take a break of 2 months or more and return with sputum positive and or clinically active disease cases. So in such a case, multiple drug resistant tuberculosis, there is a risk of developing multiple drug resistance, that is MDR, that is called as MDR. So case 2 is a case which involves patients who have already been pre-treated but have not completely been cured. So in such a case, you have got for the treatment in initial phase, you have got for a period of 2 months HRZES plus 1 month of only HRZE drug, and then for continuation phase, it is for a period of 5 months with isoniazid, rifampicin, and ethambutol, or for 5 months of isoniazid, rifampicin, and ethambutol thrice per week. And the total duration is 8 months in both the stages of category 2 drug administration. Now let's see about category 3. Now this includes new cases, new cases of smear negative pulmonary TB with limited parenchymal disease or less severe forms of extrapulmonary tuberculosis. That is, it could be affecting the lymph node, bone marrow, or peripheral joints or skin. So therefore, the treatment modality in case of category 3 will be like for initial phase, it will be for 2 months with H, R and Z. And in case of continuation phase, it will be for either 4 months with HR or 4 months of H and R thrice in a week, or for 6 months H and E daily. So whenever there is no suffix in any of these letters, it indicates that the drug treatment is on daily basis. But if ever there is a suffix like 3 is put up as suffix, that means it is thrice in a week uh, that drug has to be consumed. Now talking about category 4. Now category 4 represents chronic cases. Now these chronic cases who have remained or become smear positive even after completion of fully supervised category 2, and they are generally now categorized as multiple drug resistant cases or MDR cases. So category 4 is clearly a picture of multiple drug resistant. So multiple drug resistant TB is defined as a resistance to both isoniazid or rifampicin and both, and any number of other anti-TB drugs. So the mode of treatment in such a case is that for H-resistant cases, that is isoniazid resistant cases, the drugs R, Z and E, that is rifampicin, pyrazinamide and ethambutol, is given for a period of 12 months. Look at this, 12 months. Now it has gone beyond the previous total duration. And in case of both HNR resistant cases, you have got drugs like ZNE, that is pyrazinamide and ethambutol, in combination with either streptomycin or ethionamide, and in combination with either ciprofloxacin or ofloxacin to be used for a longer period. So this is a very difficult case to tackle. So this is all about the National Tuberculosis Control Program guidelines, wherein the patients have been categorized depending upon what condition they belong to, and accordingly the drug treatment is being modality or the schedule or the regimen is started for a long period of duration. It ranges months together, really from 6 months to 12 months, depending upon the case. So this is a very important part in this anti-tubercular drugs. You can expect a short note on NTCP guidelines. Next, we'll go to the prophylaxis part. Talking about the prevention of tuberculosis. Now, suppose if a patient is susceptible to tuberculosis and how he can prevent himself from getting infected. This is what is the slide talking about, that is chemoprophylaxis. Prophylactic therapy may be employed effectively to prevent the development of active tuberculosis in certain circumstances. So, In such a case, isoniazid 300 milligrams is very useful for prophylaxis. And however, because of its hepatotoxicity, its prophylactic use is reserved, and it is contraindicated in patients with hepatic disease and who had reactions earlier with this drug when they are consumed. And one important point also to be noted is in pregnant women, this prophylactic therapy should be delayed until after delivery. So, prophylaxis is generally with the ideal drug of anti-tubercular treatment, that is isoniazid, and this works well. This 300 milligram dose of isoniazid is very useful for prophylaxis. Okay, so we have completed with anti-tubercular drugs. We have seen about the infection, how it causes, how it spreads, which are the drugs used. We have talked about the guidelines of NTC, and this is one of the disease of national importance also, because it has not been completely eradicated. You will get to see tuberculosis infection people with tuberculosis everywhere around the country, and they are being tried with several drugs coming under these two classes. It's an important topic. Okay, thanks one and all.